Welcome to the Brilliant Board Review Podcast, your trusted source for high-yield board prep, CME, and the latest in clinical medicine.
Let's have a discussion on hydrochlorothiazide versus chlorthalidone for hypertension treatment. Ever since the ALHAT trial, it was suspected that chlorthalidone was superior. So this is a large head-to-head trial. It's patients greater than 65 years old. And patients already taken hydrochlorothiazide, 50 milligrams at baseline, most patients. Hydrochlorothiazide plus one or two additional antihypertensive drugs. 50% of the patients had prior MI, stroke, or heart failure. They're randomized switch to continue hydrochlorothiazide or switch to chlorthalidone, which is 12 to 25 milligrams daily. And they followed them for almost 2.5 years. And the primary outcome was MI, stroke, heart failure, hospitalization, urgent coronary revascularization, or non-cancer-related death, which was 10% in each group. Individual components of endpoints were virtually identical. The only thing that was interesting is that in chlorthalidone versus hydrochlorothiazide, had chlorthalidone, the hyperkalemia, which is always suspected to be worse, was 4.4% versus 6.0% in the hydrochlorothiazide. Blood pressure management were about the same, which was always thought that chlorthalidone would be superior. In our continued discussion on hydrochlorothiazide versus chlorthalidone, both are very similar, but the trials only included people who were 65 or older, and 23 of the patients had a GFR less than 60%. What about the patients with severely impaired renal function? And it's thought that thiazide is going to lose effectiveness when GFRs markedly reduce. And in another recent 12-week placebo-controlled study, chlorthalidone lowered BP in patients with GFR between 15 and 30%, but not similar data for hydrochlorothiazide. So in the marked worse GFRs, chlorthalidone is suspected to be superior to hydrochlorothiazide. But in the randomized controlled study showed no differences in cardiovascular outcomes or mortality. So this is a surprise. There's been data in the past, and recently it's always been thought that chlorthalidone had been superior to hydrochlorothiazide.
Thanks for listening. Visit brilliantcourses.com to learn more and claim credits for this educational activity. See you next time.